Welcome to Everyday Therapy, where simple and practical concepts of therapy meet your everyday life. Hosted by licensed marriage and family therapists Brett Cushing and Krista Overson, we're here to help you unlock tools and strategies you need to become the best version of yourself. Whether you're looking for guidance, inspiration, anecdotes, or actionable advice, you're in the right place. Let's dive into Everyday Therapy.
Hello and welcome back to another episode of Everyday Therapy. Today we are going to be talking about a topic that has become very popular. It's online therapy, and with the onset of COVID-19, we had a whole different way of doing therapy that had never even been considered before that is really very helpful. It allows people more access to therapy, and wow, can we really do this? Can we do therapy online in a telehealth manner?
Yes, exactly. When this came about, I remember March 2020. One day I was seeing all my clients in the office, and it seemed like, overnight, I was able to start seeing people. I think at first it was mostly over the phone.
Right.
But then shortly thereafter, Nystrom really made a quick transition to... at the time, the platform was called Life Size, and we just really pivoted in that time, and people did not have as much disruption in care as you would think.
There was a lot of anticipation that, online therapy, this is not the same, and to be honest, it did not feel the same for us as therapists.
Yep.
I remember, I don't know if you experienced this, but because much of it was by phone initially, and then you go to online, and for us as therapists, we were working harder to try to understand what's really going on. We didn't have all the nonverbals we could pick up on. Everybody was exhausted in my office.
Same.
But I think we've adapted as therapists, and I think clients have adapted as well, and they feel like, hey, this is kind of normal now.
Exactly. And I think I remember exactly as you were saying, when we got back to having the visual, we all kind of breathed a sigh of relief, because as much as having a phone conversation with only voice is still better than nothing, right? Especially during that crisis time for our world. It's still, as soon as I could see my clients again, it was just like, I feel like I have so much more information now in ways that you don't even really think about. So
It's working.
It's working, right?
And let's talk about why it works and how it works, and maybe what are some of the benefits of online therapy. The first thing I think about is accessibility.
Exactly.
Especially in more remote areas.
Yes.
People that don't have to travel so far, maybe an hour just to get to a clinic. Now they can just go into their living room or their bedroom.
Exactly. That's a huge one. I know we've seen an uptick in referrals from very small towns throughout our state. And Nystrom covering so many states now, I can only imagine that's probably very much multiplied.
It is. And then you have the other benefit of just time. Even if you live close, you're in the middle of your day. And, to even go 20 minutes or 30 minutes with traffic to an office, then I have an hour session, then I got to travel back. That's 2 hours out of somebody's day.
Yes.
Whereas maybe some people have a private office, or they're working from home, and they can just log on. It's incredibly efficient for people.
Yes. Another one is it doesn't interrupt care in the same way, or it ensures uninterrupted care, I should say. For example, during bad weather, which here in the Midwest, we have our fair share of snowstorms,
we do.
It's kind of like, okay, we'll switch over to a video for just today, right? Another one is when I've had clients that have moved within the state and are like, I just really don't want to start over with a new therapist, and then we've been able to say, like, well, what about video or online therapy? I do know, there's pros and cons to this, which we'll get into more. But I guess the flexibility that it offers is a really big benefit.
Flexibility, accessibility, efficiency, all are some of the benefits with telehealth. And some people, I understand it. They want to be in person.
Yes.
And I get it. I prefer in person. There's an energy there. I feel a greater connection.
Yep.
And the really interesting thing is that some of the outcomes we see are pretty much the same, whether it's in person or it's online therapy. And so it's not like there's a right or wrong. It's nice to have an option that can be just as effective.
Yep.
And there's really some evidence suggesting that online therapy can foster meaningful connections between therapists and patients, particularly for those who prefer digital communication. And a lot of people do prefer that now.
Yeah, exactly. There is one stat I can share. The American psychologists found in a meta-analysis that they published that teletherapy was equally effective for common mental health challenges. So now I do think we'll spend some time in a little bit about, again, so that our listeners can make an informed decision, what are the pros and cons. But I do think that for common mental health challenges, it has been shown to be equally effective.
Yes, and it really is. I think it ebbs and flows right now. I'm hearing more people are coming back to the office.
Yes.
I've heard that, and I've also heard people say, no, it's not necessarily true. It's kind of more of an uptick with online therapy.
Yep.
But I think my caseload and many of my colleagues in my offices, it's about half. I don't know what you experience.
Yep.
Yeah.
I would say that it's about half and half. I mean, we do even have therapists who work, a couple people that work 100% remote.
Yes.
So they do see more of those video sessions. But yeah, I thought it would die down more as everybody
I thought it was going to be a fad.
Right.
And then.
Yep.
But I think it speaks to what we are already saying. This is very efficient for people. It's very flexible for people.
Yep.
And it's just as effective.
Right.
And there are things for us to consider, though, when we're doing online therapy. So
exactly.
A few things to keep in mind. Privacy.
Yes.
Privacy is really important, especially if you're doing it at home. That's where I struggle. I've had people do sessions with me. They're on their phone in their car in a parking lot.
Yeah. Yep.
Perfectly fine. I've had people also in their home, which sounds great, but sometimes where do I go in my home where I can really be alone? No one is going to interrupt me or
hear anything.
Or you have somebody passing by,
exactly.
in the kitchen to, get something out of the fridge. And
pets.
Oh yes, pets are a big one. Yes.
I've seen many a cat walking across the screen. When my client is online and, all of a sudden a cat appears in front of their face, kind of like, hey.
Yeah, a little cameo.
Cat cameo appearance. Exactly.
I've seen that a lot with dogs. And it's fun. And these things can be a disruption. So we want to be careful of that. And also just private information, not only about yourself when you're talking about therapy, but even in group settings. There's a lot of telehealth that happens for group.
Oh, good point.
And crucially important that if you are in a group with telehealth, because other people can be seen, even their first names sometimes are on their screen under their picture.
Good point.
We really need to be careful to guard that. We should, as therapists, be reinforcing that all the time. But those are very confidential things.
Exactly. I think another factor to consider is the technology. So it is important to have a strong internet connection. It's important to have a device that, is working well, whether that be a computer or a phone. I think that I always encourage people to give themselves ample time. Clients, the first time that they're going to do online therapy, give yourself more time than you think you need to connect to that first call, because as you know, those are always the moments that our computer suddenly needs to update, right? It's like it's like it hasn't needed an update in years, and then it's 5 minutes before your session, and it's like, we have to restart this thing,
Yes.
And then additionally, making sure, in addition to having the technology, making sure, again, your insurance covers it. So, of course, there's always a caveat with insurance, right? I do have some clients that have a big, bold thing on their, when I pull up their information here at the clinic, it says this insurance plan does not cover telehealth, right? So people should be informed that making sure in advance that your insurance is going to cover this. Now, I think the majority of health plans cover it. There are just, again, those one-offs where they don't, but it's good to know so you don't get a charge you weren't expecting.
Right. I think another thing to consider is some people, they like to be off screen when they do therapy, or especially in a group, and they like to be off screen.
Sure. And like
Because
have their
that-
camera off.
Oh, yeah.
Yep.
Or just kind of even on, but they're off the
sure.
view of the camera. And that is very understandable. There's anxiety, especially in group therapy sessions.
Yep.
And I think we can short circuit some of the effectiveness of therapy when we just want to be off screen
Right.
all the time.
Right.
And so it's something to kind of lean into. But it does remind me of it when COVID was first starting. We were doing phone therapy.
Yes.
And a colleague of mine said he was doing phone therapy. He had to sneeze. So he put it on mute.
Yeah.
So he could sneeze a couple times.
Yeah.
He listened to what the client was saying, and he had this great information to share that was going to be life-changing for him. And so he responded to his client, and he's going on and on, talking all this really great information that's going to be super, super helpful. And I mean, I don't know how long he was going, but he said I was going on for quite a while. And then he realized he still had his phone on mute that entire time. And so then the client actually started to speak up and said some things that were incredibly helpful for him. And so it was pretty funny because the therapist thought, oh, I got all this great information.
Totally.
And yet that silence is exactly what the client needed to get that insight.
Oh my goodness.
So
That's classic. I
yeah,
love it.
technology can work in your favor when there's problems, but all in all, it can be a bit frustrating. So
Exactly.
you want to kind of go into it realizing that, that there's going to be these things, but I think we're also used to that. You know, we're used to doing this. Even doctor visits and things are able
So
to do
true.
through telehealth as well, and so it's something we get a little bit used to now.
Right. And I actually, I think one of the when we talk about the pros and cons, I do think a con is that of online therapy is that sometimes it's so convenient that sometimes I've seen people try to squeeze in a session like on their lunch break at work.
Yeah.
Right. And again, I'm not saying that's a bad thing, but even, I'm driving right now. Right. Or I only have 25 minutes and I just need to. So again, for some people, if that's the difference between having any therapy and having no therapy, I would say that's better. Right.
I think you bring up a really good point.
Right.
Did I catch you
No,
off?
go ahead.
Okay,
Go
because
ahead.
I think you bring up a really good point that it is so easy that it can almost feel like drive-through service.
Yes,
And
exactly.
we're going to get out of therapy what we put into it. And so to think sometimes that I'm just going to squeeze this in, maybe we're really not putting ourselves all in with therapy. For instance, after a session, many of us can be emotionally drained. And then
Right.
to think I'm going to be done with therapy, then I'm going right into a meeting or
Yes.
something like that.
Yes.
And
Yep.
really hard for people. So I would say give yourself that time, like you're saying,
Yeah.
for that first session to kind of
Get used to
iron out
everything.
the wrinkles of technology
Yes.
and things. But also consider, do I need time afterward?
Yes, exactly. Like just for myself, right?
Kind of gather myself. Right.
Right. And actually, that reminds me of one other piece of this topic is so often when people come into the therapist's office, it signals the body and brain, I'm in a safe place. I'm in a place where I'm not going to be judged. It's like it almost cues your brain in a way, like this is my place to talk and be vulnerable, right? So I encourage people, if you're going to do online therapy, consider having a place like that, even if it is just at your home, that it cues you to kind of go into that mode. Because if you're kind of like, oh, now I'm in the car, now I'm in my office at home, now I'm sitting in the parking lot, again, I'm not saying those things are wrong, but it does set you up. If you have that consistency, it sets you up for, just the way we work as human beings, right? It might cue your brain that you're, okay, I'm in my place. Yeah.
Never really thought about that, but that's, I think, Krista, a great point.
Thank you.
Because I've heard people, they like my office.
Yeah.
Because of that safety. And
Yes.
they know that, okay, now I can really let down. And so maybe in doing telehealth, people can not find this common area that we're used to, but heck, almost like a sacred place that
No, truly.
you can feel really secure, comfortable,
Yes.
and not have to worry at all. And that's really for yourself. I mean, this is you taking care of you and really
Yep.
being all in with your therapy.
Yes, exactly. I do think too, when we're talking about conducting, a client conducting their therapy session elsewhere, right? Like maybe in their car or sitting somewhere. I do think it is very important to always let your therapist know where you are.
Right.
Physically, where are you located, and whether that's an address or a milestone or something like that, or a landmark. I mean, just in case there's ever a crisis situation, because that your therapist's job is to make sure that you're safe. And if you are having any sort of crisis, that therapist, I mean, they should be asking, but again, just setting you both up for success, right?
Absolutely. What a great point. Sometimes things come up and therapists really need to know where you are. And I've known where that has gone south a little bit. We didn't know where people were and hard to find them. So
Yes, exactly.
a few things just to be aware of. And again, I just really want to emphasize therapy's bottom line going to be a lot what we put into it.
Correct.
And so if you treat online therapy very much like you would for in-person, with the mentality that I am really going to work on some things, I'm going to do the hard work, definitely the research there that online therapy is just as effective.
Right, exactly. I think too, I wanted to just get into with telehealth or online therapy, there's not a one size fits all, right? I know I've kind of said this earlier in the episode, but I do think your therapist, I mean, again, just kind of being aware that your therapist might suggest that you do in-person therapy at the end of the day, because you again, the idea is that they're going to assess you, they're going to get a history, again, with what to expect for a first session, right? You might start your therapy online, even just to be able to get in sooner, right? To get in for that appointment sooner.
Yeah.
And then based on what you're dealing with and maybe you have a clinical picture that's very complicated, so the therapist may actually end up recommending that you come in.
No different than you go see your doctor, for instance.
Right.
And some doctors might say, well, for this, you can definitely do telehealth.
Right.
However, you go see a dermatologist and they say, I really need to have you come in so I can have more hands-on.
Right.
And you might think, well, what do you need to see? Well, it's just that things are more intense for some of us, more complex.
Yes.
And coming in, like you're saying, is going to be something that therapists might recommend.
Right.
And then the good news is you can also look at a hybrid sort of thing. Like sometimes you're in, sometimes you're
You
doing
alternate.
online. Yeah.
Yep. I was trying to think of a good example of where a therapist might recommend that. I think one thing I've seen is when someone is extremely depressed and isolated.
Right.
And again, it's different if you live in a remote area, you're really too far away. I mean, that's a different thing altogether. If you are able to sometimes come in, I think just, again, reducing that isolation and having you be out and about and doing something, getting up, getting dressed, right? Like with depression, it can be so hard to do those things. So I think you can come up with a personalized treatment plan, of course, with your therapist and decide what to do from there. So
all in all, online therapy can be very effective, and we also see that people feel the connection with their therapist very similarly as if they come in. So it is a viable option that does offer a lot more flexibility, a lot more efficiency with the same effectiveness.
Exactly.
And so just be aware of those benefits as well as some of the hurdles that come up. And I think bottom line, it's going to be what you and I put into our therapy.
Yes, exactly.
Determine the outcome.
Exactly. I do say, I guess the last thing I'll say is try it out. If you're someone who you've said, I'll never try therapy, I just, you're kind of a diehard, like, it's not for me. Maybe this is the way that you kind of stick your toe in the water and see what it's all about. because again, it is more convenient. You don't have to go to an office. You just kind of have the comfort of your own home, especially like if you have social anxiety, right?
Right.
And you might try it, you might not like it, but give it a try, see what you think. I also think you can it doesn't have to be black and white. Like you said, you could do a hybrid. You could kind of tailor it to fit your lifestyle. But we do, as always, just invite feedback from our listeners. A reminder to subscribe, leave us a review. We'd love to hear from you. What have your experiences been with online therapy? The good, the bad, the ugly, right? It's not for everyone, but it also has helped people that never would have come in and gotten services. So,
well, I love what you said. Give it a try if you haven't tried it.
Yep.
And there are other options. We appreciate everybody tuning into another episode here on Everyday Therapy. We look forward to connecting with you next time.
Thank you for listening to this episode of Everyday Therapy. We hope you're inspired to apply today's insights to your own life. Don't forget to subscribe so you never miss an episode. If you found this podcast helpful, please leave us a review. It helps others discover the show and join our community. See you next session. Everyday Therapy is a production of Nystrom and Associates, one of the largest behavioral health organizations in the country. To learn more, visit nystromcounseling.com.